Hi, and welcome back to Zero's 2021 Virtual Summit. My name is Shelby Monier, Vice President of Patient Programs and Education here at Zero. Our next presentation is about navigating finances and insurance during your prostate cancer journey, and we're so honored to introduce you to our speaker for this next discussion. Joanna Morales is here with us. She is a cancer rights attorney and the CEO of Triage Cancer, a national nonprofit that provides education on practical and legal issues that may impact individuals coping with cancer as well as their caregivers. Joanna is also on Zero's medical advisory board. And Joanna, thank you so much for being here. We know everyone's schedules are so hectic, and as the CEO of Triage Cancer, we can't imagine what's happening there. So thank you so much for being here with us tonight on our final night.
It's my pleasure. Thank you for having me.
And we will hand it over to you, and I will zip it.
Thank you. So in talking about navigating finances and insurance, I want to start by telling you a little bit about what Triage Cancer does and the resources that we provide around finances and insurance so that you know where to go for more information after tonight's program. So if you're not familiar, Triage Cancer is a national nonprofit that provides education on all of the legal and practical issues that come up after a diagnosis. And as you can see, that actually runs the gamut. And we do that by providing free resources on our website at triagecancer.org. And then we also host free educational events like our conferences and our monthly webinars. We also have state-specific information on our website for you to take a look at. And then we have resources organized by topic so that you can find the information easily. And because we know that some of these topics are not super exciting, like health insurance and finances, and because not everybody likes to read lots of information, we have a series of animated videos that cover some of the most important things that we think people need to know about navigating insurance, finances, and other topics. We also host a site called cancerfinances.org that provides education on topics that might impact your financial situation and then connect you to financial assistance resources. But what is unique about this site is that you can go on and pick a topic and then start to answer questions based on your situation. And then it will tailor the information based on how you've answered those questions. So you get the information that is most relevant to you. We also, I am excited to announce, have just rolled out a legal and financial navigation program, which is something that we have always offered. We just haven't advertised it. So we will answer people's one-on-one questions who call us or email us about any of those legal and financial issues that might come up after a cancer diagnosis. So if you need assistance, you can fill out a contact form on our website. Now, when we're talking about financial toxicity, this is a term that describes the burden, the financial burden that can come with a cancer diagnosis. And while financial toxicity is a relatively new term that was coined by some researchers from Duke in 2013, it's not a new problem. It's something that has always been a challenge. The cost of cancer care is high. And so part of the challenge in that is, well, how do you solve financial toxicity? And the answer isn't easy because there are lots of contributors to financial toxicity. So it's not just one reason there's a financial burden. And we think that health insurance status is actually the primary reason for financial burden, where someone doesn't have adequate health insurance coverage and they have very high out-of-pocket costs. But certainly someone's employment status can also have an impact on their income. So if you're not able to work and you don't have any income coming in, that's going to impact your financial situation. So understanding your employment rights and how you can access disability insurance is one of those ways to address financial toxicity. But certainly there are lots of other things that just happen with life, like graduating from school or moving or getting married, that are going to have an impact on your finances outside of a cancer diagnosis. So we actually created a checklist to avoid financial toxicity. And you're not supposed to be able to read this screen, but this is a visual representation of the questions that we think are useful for people to pose and find the answers to be able to navigate effectively and avoid financial burden. So this checklist is available on our website. And not only does it pose the questions, but it also provides a list of all the resources that we have to help you answer those questions. So it's a guide to get you through to the information that you need. So I often say that there should be a class in high school on health insurance because it's one of those things that everybody needs, but no one really explains to us how health insurance works or how our healthcare system works. And so if you feel like you don't understand your own health insurance coverage, you are absolutely not alone. There's plenty of data to show that people don't understand our healthcare system or their own health insurance coverage. So only 4% of Americans could actually define all of the terms in their plan. And only 40% of Americans said that they were very confident that they could choose the right health insurance plan for them. So this is definitely a challenge in talking about health insurance. So in the United States, we only get health insurance coverage from 3 places. We're either getting it directly from an insurance company, we're getting it through the government. And by that, I mean Medicare, Medicaid, military and veterans plans, or maybe state or local programs. But still 50% of people in the United States get their health insurance coverage through an employer. So these are the terms that we think everybody should know about their health insurance coverage, regardless of where you get your coverage. And the first term is about what it costs to have health insurance. We pay a premium to have a health insurance plan, and we usually pay that monthly. And your monthly premium is going to depend on the type of plan that you have. But then there are costs that we pay when we get medical care. So the first thing that we have to pay is our annual deductible, which is a fixed dollar amount that we have to pay first before our health insurance coverage even kicks in. And then there's something called a copayment. So this is a fixed dollar amount that you pay when you get certain types of care. You might have a $10 copayment to visit the doctor's office, or you might have a $25 copayment to see a specialist, or maybe you'd pay $250 if you had to go into the emergency room. And that's different from coinsurance or cost share. And those are 2 terms that are used the same way. It's the difference between what insurance companies pay for our medical expenses and what we pay for our medical expenses. So if you have an 80-20 plan, the insurance company is going to pay 80% and you're responsible for 20% of your medical expenses. And then probably the most important thing that anyone should know about their coverage is their out-of-pocket maximum. This is also a fixed dollar amount that when you reach that fixed dollar amount in out-of-pocket expenses, your insurance will actually kick in at 100% for the rest of the year. So you might have a $1,000 out-of-pocket maximum, or you could have a $20,000 out-of-pocket maximum, depending on your plan. And the way that you reach your out-of-pocket maximum is actually a math problem. So you get to add up what you pay for your deductible, plus any co-payments that you make during the year, plus any co-insurance amounts that you pay, and that will help you reach your out-of-pocket maximum. And again, when you do, your insurance will kick in and pick up 100% of your medical expenses for the rest of the year. So in a worst case scenario, it's the most that you're going to pay out of pocket for your medical expenses. So to give you an example of how this works, Dan has a plan that has a $2,000 deductible. It's an 80-20 plan, and he has an $8,000 out-of-pocket maximum. And he has spent a week in the hospital and walks out with a $102,000 hospital bill. Assuming he's had no other medical expenses during the year, how much does he actually have to pay of that bill? So first he's going to pay his $2,000 deductible, which leaves $100,000 left of that bill. But he has an 80-20 plan, meaning that the insurance company is going to pay 80% and he's responsible for 20% or $20,000. But how much of that $20,000 does he actually have to pay? Because he's already paid his $2,000 deductible and he has an $8,000 out-of-pocket maximum, he only has to pay another $6,000 of that $20,000 bill, and then he'll have reached his out-of-pocket maximum, meaning the insurance company is going to pick up the rest of that $20,000 bill. So I'm not suggesting that $8,000 isn't a lot of money, but it's better than having to pay the $20,000 if there wasn't an out-of-pocket maximum, or to even have to pay the $102,000 hospital bill that he started with. So what I just explained in the terms and Dan's example is actually in one of our animated videos called Health Insurance Basics. So there are a number of consumer protections in the law that relate to health insurance and have been very useful for the cancer community. And most of those protections are from the Affordable Care Act. And one of the things that the ACA did was protect people's health insurance rights, meaning that when insurance companies decide how much to charge us for our policy, they're only allowed to take into consideration certain things now. And that process is called premium rating. Previously, insurance companies could look at whatever they wanted to. And now they can only look at four things: whether or not you're buying a policy for an individual or family, because if you're covering more people, they can charge you more; where you live based on your zip code; your age, but they put a cap on how much more you can get charged as you get older. There was previously no cap. And then if you use tobacco products, you can be charged more for health insurance coverage. So what's missing from this list? It's actually things like pre-existing condition and also gender. Women have always been charged more for health insurance coverage than men, and that's no longer allowed. And then the ACA went one step further and said insurance companies can't deny you health insurance coverage based on your age, your gender, where you live, your pre-existing condition, or really anything else if you can afford the plan. So these two things together are what we refer to as the pre-existing condition protections, meaning that an insurance company can't deny you because of your cancer diagnosis, and they can't charge you more because of it either. And that's really game-changing for how people can get health insurance coverage in the United States. The ACA also created a protection for people who wanted to participate in clinical trials. Previously, if you wanted to be in a clinical trial, you would have to pay for all of the costs out of pocket. Sometimes the trial would pick up the thing being tested in the trial, but you'd have to pay for everything else out of pocket. And the ACA now requires private health insurance companies to cover the routine costs of participating in a trial. And the routine costs are generally all the things that would have been covered in standard of care, like office visits and blood work and imaging scans. Those things have to be covered by your insurance company. So about half the states had this protection before the ACA. So some state laws might actually even be better than the federal law. And Medicare, TRICARE, and VA health all cover the routine costs of participating in a clinical trial. And I am excited to announce that just this January, Medicaid in every state now also has to cover the routine costs of participating in a clinical trial. And so the last consumer protection that I want to talk about is appeals. It is not uncommon for an insurance company to deny coverage for a particular type of medical care, whether it be surgery or a prescription drug or a certain type of treatment. And when they deny coverage, people often take no for an answer, but they actually have the right to appeal that denial through the insurance company, which is referred to as an internal appeal. But if the insurance company still says no, now you get to go outside the insurance company to what's called an external medical review or an independent medical review entity. And that entity is going to look to see whether or not the care that you've been prescribed is medically necessary. And if they decide that it is, that decision is binding on the insurance company. So this protection came from the ACA. There were some states that had this protection before the ACA, so some of you might already be familiar with this. But what is interesting is that I think that this is the best kept secret of our healthcare system, because very few people actually appeal denials of coverage. But when you do, on average across the country, 50% of the time, people are winning their appeals. Now, the data point on the slide is actually from California, where it's 60% of the time patients are actually winning coverage for their care. Now, the reason I think this is the best kept secret is because of the data. So in 2019, there were more than 40 million claims that were denied, but only 0.2% of those claims were actually appealed internally, meaning they didn't even get to an external appeal. So when you think about the fact that 50% of the time insurance companies are getting it wrong and those appeals are being overturned, that means there are at least 20 million claims that likely would have been overturned, meaning 20 million people didn't get the care that they needed, or they paid for that care out of pocket rather than having their insurance company cover it. And so I really, really can't stress enough the importance of going through the appeals process if you're facing a denial. And we have tons of resources on the appeals process. So I do just want to mention that the state health insurance marketplaces are reopened. So the state health insurance marketplaces are effectively insurance shopping malls. It's a place where you can go to find your private health insurance options available to you where you live. But there are some benefits to actually buying coverage through the marketplace. There's a cap on those out-of-pocket maximums. You might also qualify for financial assistance based on your income level. And there's two types of financial assistance. There are premium tax credits, which lower your monthly premium, and there are cost-sharing subsidies, which lower what you pay for your copays and your deductibles and your coinsurance amounts. Now, the reason this is important and sort of late-breaking news is that the marketplaces are usually only open for enrollment in the fall, in November and December. But the federal government has actually reopened the marketplaces from February 15th through May 15th of this year to help people enroll in health insurance coverage as a result of COVID. Now, the marketplace plans are all standardized based on their cost share. So the lowest level of coverage is a bronze plan, which is 60/40, and the highest level of coverage is a platinum level plan, which is a 90/10 plan. Medicaid also had some changes under the Affordable Care Act. So prior to January 1st of 2014, you could only get access to Medicaid if you had a low income level, a low resource level, and you met some other category of eligibility. And so there were these different doors into the Medicaid program. And the door that people in the cancer community were typically sometimes able to walk through was the door called the Aged, Blind, and Disabled program, which is not a great name for a program, but effectively it meant that someone was going to the Social Security Administration, qualifying for supplemental security income, and then getting access to Medicaid in their state. So that's a lot of hoops to jump through. So the ACA actually created a new door into the Medicaid program that we call Medicaid Expansion. And it's for anyone with a household income level up to 138% of the federal poverty level, which for this year is $17,774 for an individual. Now, the ACA, in creating that new door, it kept all the old doors. So you can still qualify through an old door, but only the new door is the door that doesn't require anything but a low income. So it actually is a little bit easier to walk through that door. The ACA made it mandatory for every state to create that new door, but then the Supreme Court got their hands on the Affordable Care Act and made it voluntary for states to participate. So this is what it looks like as of today. There are states that have expanded access to Medicaid and there are states that haven't. So assuming that you have you're in a state that has expanded access to Medicaid, if you have a household income up to 138% of the federal poverty level, you have access to Medicaid. If your household income level is between 138 and 250% of the federal poverty level, you have access to the cost sharing subsidies. And if your household income level is between 250 and 400% of the federal poverty level, you just have access to the premium tax credits. which effectively means if you have a family of 4 making under $104,000 a year, you're getting access to some type of financial assistance to buy a plan in the marketplace. Now, Medicare is the other federal health insurance program that is available to individuals who are 65 years or older and eligible for Social Security retirement benefits, or to anyone who's been receiving Social Security disability insurance for 2 years. And then it also automatically provides Medicare to individuals who have end-stage renal disease or ALS. Now, I could probably spend 8 hours just talking about Medicare, so I won't do that with you today, but I will point you to the variety of resources that we have available to help you navigate Medicare. And so we have a webinar that's recorded on our website. We have a number of different quick guides. And then we also have the health insurance module on cancer finances. Now, I want to walk you through a quick exercise on how you actually compare your health insurance options that works if you are comparing different marketplace plans, if you're comparing different options that your employer gives you. You can compare what your employer gives you to what's available in the marketplace, or you can compare your Medicare plan options in the same way. So here are 3 plans. There is a bronze level plan with a monthly premium of $173 a month and a $6,000 out-of-pocket maximum. There's a silver plan that's $271 a month with a $5,200 out-of-pocket maximum, and a platinum level plan at $398 a month with an $1,150 out-of-pocket maximum. So assuming that you're going to hit your out-of-pocket maximum during the year, because when we're talking about the cost of cancer care, the likelihood of you hitting your out-of-pocket maximum is pretty high. Can you tell just by looking at these plan options which plan is actually going to cost you the least by the end of the year? So it's not a trick question. The answer is no. You can't tell just by looking at them. You actually have to do the math. And the way that you do the math is that you take the monthly premium and you multiply it by 12, because that's how much it's going to cost you to have the plan for the year. And then you add that to the out-of-pocket maximum. So in this example, it turns out that the platinum level plan actually ends up saving you more than $2,000 by the end of the year. But we look at the plan and we look at that monthly premium and we kind of get sticker shock and we think, well, that's got to be the most expensive plan. But it's because most people don't understand how out-of-pocket maximums work. And if you have a serious medical condition, that's really important to understand how they work. And how to do the math so that you can actually tell what a plan is going to cost you. We have a lot of resources on how to pick a health insurance plan. We have an animated video, but we also know that you might be needing to pick a health insurance plan because you're eligible for Medicare. So we have those resources available. Or you might be needing to pick a health insurance plan because you're losing your employer-sponsored health insurance plan, the plan that you get through work. And so we not only have a quick guide to talk about your different options in that circumstance, but we also have an animated video that can help you figure out your options there as well. So I do want to mention, beyond having health insurance coverage, it's important for you to understand how to use your health insurance coverage. And that includes knowing how to deal with your medical bills. Once you receive a medical bill, it's incredibly important for you to check it for accuracy. There are studies that range from 7 to 80% of medical bills have errors in them. And some of those errors are just human error. So someone typed in an 11 instead of a 1. Some of those bills, you got assigned costs that were actually from your neighbor in your hospital room. There are all sorts of reasons why there might potentially be errors. The fact is that there might be. And it's important for you to actually check your medical bill before you pay it. Now, if you don't feel like you have the capacity to do that, there are definitely people can help. There are actually professional claims assistance professionals who will review your medical bills, but those are services you typically have to pay for. I do want to say stay tuned for an exciting new program that we're going to be rolling out in April around dealing with medical bills and reviewing them. But you can go through this process, and we actually have a number of resources on our website to give you tips and tools on how to actually do this. And if you need help with your medical costs, once you've actually figured out what your actual medical bill is and what you are responsible for paying, you do just want to make sure that you weren't denied coverage for anything. And if you were, go through that appeals process that I mentioned. But there are also lots of organizations out there like Zero that provide financial assistance. You also might be able to get financial assistance from a pharmaceutical company if you need help paying for your prescription drugs. They also have a number of different programs that can help you lower your out-of-pocket costs for your prescription drugs. And then choosing a health insurance plan isn't a one-time chore. It's actually something that we now have the ability to do every year because of those pre-existing condition protections in the ACA. But it's also really useful to check your health insurance coverage each year, because a plan that worked for you last year might not be the best plan for you this year, because you might have different medical providers or medical conditions. You might be taking different prescription drugs, or the plan might just cover different things. And so it's always important to check to see if the plan is still working for you. And again, we have a lot of resources to help you figure out the next steps if you decide that that plan doesn't work for you anymore. So with that, I think we're going to take some questions.
Great, thanks, Joanna. We do have a couple of questions before we wrap up for the night. So we'll start with our first one. And it's a fairly simple one, but I'm guessing that the answer is going to be a little bit nuanced and detailed. But this person is just asking, what can I do if and when insurance refuses to cover my treatment that the doctor recommended?
That's actually a really common scenario. It doesn't sound like it should be, but it happens pretty frequently. And so if you're in that situation, the first thing to do, I think, is to talk to your healthcare team. So to go to the doctor who prescribed that medical treatment and let them know that your insurance company denied it, because your healthcare team can often help you with the appeal to the insurance company. And then understanding more about your appeal rights based on the type of insurance that you have. So I mentioned external medical review as the best kept secret of the healthcare system, but that actually only applies to private insurance. If you have Medicare, there is a different appeals process. If you have Medicaid, they have their own appeals process, and the same thing with military and veterans plans. So knowing the type of coverage that you have will direct you to what type of rights you have related to the appeals process. But your healthcare team can also give you information about why your treatment is medically necessary. Your doctor obviously prescribed a treatment for a reason, like they had a thought process. There's a medical reason for why they made that decision. So collecting that information is going to help you in your appeal. And many providers will actually file appeals on behalf of their patients. So they're definitely a resource if you find that you've been denied coverage for something.
Sure, that makes sense. I think one of the tips that we've heard at Zero, and I'm sure you've heard this and can expand on it, is to make sure that you don't get behind the curve, so to speak, that you jump the gun and you make sure that you're not going to be in a situation where you're really struggling. Even if you might have maybe two careers, maybe both of you, the patient and the caregiver are employed and you have good insurance, but what are some tips for patients who feel like they're probably okay and set financially with pretty good insurance, but for those people to not get behind the curve?
I think the number one thing I recommend to everyone is understanding your rights. So what I would tell every newly diagnosed patient I came across is make sure you understand all of your options. You might be really familiar with one option, or maybe your employer presents you with one option, but if you know what all of your options are, then you can actually make some educated choices about which option is actually best for you. And we often, we appreciate when our employers give us health insurance coverage in the United States, but sometimes it's not a great plan. Sometimes it has a very high deductible or a very high out-of-pocket maximum. And for employers that don't contribute to the premiums and you're having to pay that premium yourself, it's actually worth checking to see what your other options are, like going to the marketplace and seeing what's available to you there and comparing it to your employer plan, because it might actually end up costing you less to go find a plan in the marketplace than keeping your employer plan, even if they do contribute to the premiums. So that's why doing that math is so important. I thought by being a lawyer, I could avoid doing math for the rest of my life, but it turns out that's not the case. So doing the math related to health insurance, regardless of what type of insurance you have or where you get it from, is going to make all the difference in lowering your out-of-pocket costs.
Right. Well, such good tips. Thank you so much for taking the time this evening. We have links to Triage Cancer in our app and in our session, so we'll make sure, and they're all over our website too, of course, so we'll make sure that the patients and caregivers listening in the prostate cancer community is well informed with all the tools that you mentioned. And so thanks for sharing a couple of those resources that your team has. And thanks so much for being here. We're so grateful for your time.
Thank you so much for having me.
Thanks, Joanna. Well, with this topic, our 2021 virtual summit is coming to an end. I want to take a moment to thank all of you, all of our amazing sponsors, our champions, our advocates, our speakers, our virtual lounge leaders, and most of all, our patients, our caregivers, our survivors. Thank you for spending the last 5 days with the Zero team. I'm sure that you are as tired as we are, perhaps. If you missed a talk, please make sure that you visit our Summit app, find it on YouTube, find it on our website at zerocancer.org. We hope that the presentations helped you in your journey, helped you feel like you're not alone in this, and that the Zero team has your back, and all of our awesome speakers are there for you as well. And with that, be sure to save the date. If you missed it, we have a 2022 date in the books. We're going to be back in person, fingers crossed, that we're in a slightly better place. We're planning to be in person March 6th, 7th, and 8th of 2022. We'll be back at the Gaylord. We're so excited to be back at that awesome location at the National Harbor in Washington, D.C. Last, but certainly not least, I'm going to do a shameless plug for our program evaluation. Tomorrow, you're going to receive a post-summit evaluation. I'm personally begging you to fill out for us. We value each and every one of your comments and thoughts. We know that your feedback, and I want you to know that your feedback is going to help us build an even better event for you next year. So we can't wait to see you in person. Hopefully you can attend one of our run walks when it's safe, and hopefully again at next year's summit next March. In the meantime, please stay safe, stay healthy, and with that, good night.